Imagine waking up one day and feeling sick, but you have to choose between either going to see the doctor or paying your rent. For millions of people here in the United States and all over the world, that's a real choice that they have to make. And the Commonwealth Fund says that almost half of low income Americans skip medical care because they can't afford it. Having access to affordable health care is not always guaranteed, especially for low and middle class income people. Even in wealthy countries or growing economies, many people still can't afford basic health care. It's just too expensive. This affects all of us. It affects your grandparents, your parents, your neighbors, and even yourself. If we don't push for real changes now, the gap in healthcare access will keep getting worse, more expensive. It will hurt both people's health and their finances, of course. Today, I will walk you through the problem of healthcare affordability, inspect its roots causes, and present practical evidence based on answers that we can support to change this crisis. Let's go ahead and talk about the problem. First, the main problem is that the lack of affordable and reasonable access to healthcare, mostly for low income individuals. For years now, in many countries, like I said, and even rich countries like the United States, have had this problem with cost of healthcare. The Commonwealth Fund found that people with lower incomes still struggle to get the care that they need. Like I said, even in wealthy nations, which makes the situation worse for those who really, really need it the most. In the United States, low income individuals are 3 times more likely to skip medical care because of cost compared to those with higher incomes. Um, the cost of healthcare is just way ridiculous. And it's just, it's really sad to even think about the people that really, really need it and can't afford it. Now that we've discussed this problem, let's talk about what's causing it and see what we can do. This problem is mostly caused by a shattered, profit focused healthcare system and a lack of community based support options. Many healthcare systems but profit before people, which means that those who can't afford to pay out of pocket often go without the care. In low and middle income countries, the lack of organized community based healthcare makes the problem even worse. Analysis found that community based health insurance improves access to care and reduces financial hardship in low and middle income countries, providing the system. Strategy matter. Now that we understand the causes, let's explore how we can maybe solve this issue or try to do something to, kind of help out and see what we can do to our community to help our our neighbors, our grandparents, our yourself to be able to have this stop and help people be able to get their own medical insurance and stuff. Um, we must support policies also that implement universal health coverage and expand community based insurance systems. We have to support and speak up for the community. And we have to speak up for just ourselves, not just for ourselves, but for the country and all over the world. This kind of system might help create fairer and more equal health outcomes for everyone. Study in Health and Human Rights Journal found that countries with universal health care see better health equity and outcome across all demographics. Now that we've explored some of the unlawful solutions that's going on, let's bring it all together and try to, conclude all of this. Like I said, healthcare inequality and the incapacity to afford care is still the main issue all over the world, including in many wealthy nations. We looked closely at the problem. We investigated its root causes and showed how community based and universal health care offer practical evidence backed solutions. And as the saying goes, a nation's true strength is seen in how it cares for its most vulnerable. We all share the responsibility to push for a fairer, more just healthcare system because no one should have to choose between going to the doctor if you're feeling sick or paying your rent. It's not okay at all. Thank you for listening.